breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
Welcome everyone to this week's episode of Brainstorming. I'm Dr. Kolby Condos with my co-host, Dr. Glenn Harrison. If this is your first time experiencing the channel or having access to the channel, and you're looking for information and some possible management strategies for common health conditions that you might be suffering from, please give us a like and subscribe so you get notifications when new content rolls out. That way you don't miss important information for symptoms or conditions that you might be suffering from. So to get started today, we are going to break down common skin conditions that many people are suffering from, whether that's psoriasis, dermatitis, or acne or eczema. We are going to take care of all that today. We're going to break down some common causes and what are some treatment or management options for those of you that are suffering from it. So without further ado, let's get this thing rolling. How are you doing today, buddy?
I'm doing great, Dr. Kolby. Yeah, I think this is an excellent topic. I see problems with skin disorders every day in my office, and I know you do as well.
You know what's crazy is, so we decided last week that we were going to cover it this week, and the day after we talked about this, I had a patient come into my office and she had a huge rash on her forehead right here. And she's like, I don't know what this is. It's terrible. And it looked awful. It was red and it had a bunch of oozing sores. And I was like, oh yeah. I mean, it's just so common and people really don't understand it. So I figured that would be a perfect segue. I told her, all right, you need to go in, you need to get it tested. I think that you have a staph infection. Mm-hmm. So going to be a great segue this week to break down it for everybody. So, and
then after she gets out of the clinic, she should watch this video and listen to the podcast.
After you've gone on the antibiotics and you actually get rid of this, let's revisit this and you can watch our podcast.
Yeah, so it doesn't happen again.
Yeah,
it doesn't happen again. Yeah, these skin disorders, they're everywhere. A lot of people I know come into my office. And they come in for one problem. Maybe it's a digestive problem, a neurological problem, whatever, an energy problem, some metabolic problem. But then once we start looking through their case and doing an exam, we see all these skin disorders. And they're like, yeah, that's been going on for a while. A lot of times it's just another symptom. It's another problem that they don't see as being the focus. Some people, like in the case you're talking about, it is everything. But these skin disorders always mean something, and then once it's done right, I know you see it all the time. I see complexions change every day in my office, from before and after the work that we're done. So why, Dr. Kolby, why are skin issues so important?
Well, I think one of the big things with skin conditions is people are vain, kind of, I am, you are, and we're tied up so much in our appearance. And a lot of individuals are very self-conscious about what they have going on with their complexion or with their skin tone, or if they have a rash or if they have acne or whatever. So I think a big part of our self-esteem is tied up in what our physical appearance is. So I think that that's a really big component to why people are often super interested on how they can improve their skin condition, how they can improve any sort of rash that they have going on. So I think that that's probably one that's really, really, really common. But then you look at the other reasons, because like you said, it can be a symptom of underlying things. So I have people that have digestive issues. They come in with skin rashes or little pimples or seborrheic dermatitis or whatever. And yeah, so a lot of people, it's either the emotional part of it and that self-worth, or it's an adjunct symptom to what they have going on underneath. So
yeah, that's a good way of putting it, an adjunct symptom. Yeah. So what are, I see so many different common skin disorders that come in. In fact, one just came in yesterday with psoriatic arthritis, but it's very consistent with the psoriasis, right? And there's such a connection there. If it gets bad enough, then you see this. Actually, usually we see the psoriasis, and then if it gets bad enough, then we see the psoriatic arthritis. Is that what you see?
Yeah, actually, so my mom actually has psoriasis, and that was initially what she had. So she had the flaky rash and all that kind of stuff, and she went a long time without it actually being diagnosed. And fortunately, she had it a lot worse when I was younger, when she was under a lot more stress. You know, my father and her were both self-employed and owned a big business. And stuff
Maybe
like
you created the stress.
I'm sure that I did. Actually, I'm blaming my brother Dustin. If you're watching this, Dustin, mom psoriasis was all your fault. So, yeah, I mean, experience with that. I mean, she got it managed well enough. She was super fortunate to find a provider that was really knowledgeable in that, because they took care of it and they managed it well before it turned into the arthritis. But yeah, I mean, it's huge. And she was super self-conscious about it.
Of course.
And she was really focused on taking care of that before it became a big problem, because I mean, I have a patient that it's everywhere. It's all over their arms, their legs, their back, their scalp, their face, and they are really self-conscious about it. So
yeah, so psoriasis is just one common skin issue. You get the eczema, the acne, just dry, flaky skin, dermatitis. What else do you see out there?
well, I mean, we have patients with vitiligo, which isn't necessarily like a rash, but my wife is also a doctor. She's a chiropractor also, and she has a lot of patients. She had one in particular that was really interesting because she had vitiligo, which is like the pigment in their skin was actually changing color. And that was another one that I wouldn't have thought about it because I don't suffer from it, but they were really self-conscious about the fact that their skin was different tones.
Yeah.
That's a big one. So I think as we kind of get into that, and that's actually an autoimmune condition. So that's actually probably a really good segue right there, because when you think about when people are suffering from skin conditions, you can basically break them down into a couple of different like subcategories as far as like what are the causes. You know, the cause could be, you know, is it irritation? Is it some sort of infection? Is it an autoimmunity? You know, is it bacterial? Is it viral? You know, because you look at someone who has like shingles, that's going to be a viral infection. You know, if you look at someone like the patient I had where we think it's staph, that's bacterial. Vitiligo, that's autoimmune.
Yeah, I think the skin is really a significant part or an indicator of overall health status, or kind of the chemistry makeup of what's going on inside the body. It has to show up. It has to expose itself. And if there's bacterial infections, the skin is going to show it. If there's autoimmunity, the immune system loves to attack skin. That's why the biggest tool dermatologists have are steroids. They're trying to shut off the immune system. And then there's, of course, that toxic component. I know we talked about this before, Dr. Kolby. If people are toxic, it always starts to show up in their skin. You've probably seen cases like that, right?
Yeah. I mean, I have a patient right now that has a gluten intolerance, comes out through the skin. Like number one thing, first thing it comes out is she gets like little bumps on the back of her arms and on her face when she's been exposed to gluten that she wasn't aware of. So
wow, yeah. And yeah, those toxins always, so you ever hear those, you know, people call them liver spots. They get like markings, dark pigmentations in spots. Did you ever see that?
Yeah, I've seen that. Actually, I was talking with a patient about that today because she came in and she was like, oh, I saw this thing on Instagram or something. And she's like, and it's supposed to help with sunspots and liver spots. I'm like, oh, okay. Yeah, great.
Yeah, but I find from a toxic argument, because I know we talked about all those other things, but from a toxic argument, I get a lot of people, regardless of age. I've seen people in their 90s. And then once we start, you know, working at and clearing their toxic load, detoxing their bodies, once they start detoxing, not everybody, but most, you're seeing these liver spots, or they also people call them age spots, disappear. It's like they're flaking off. And you know, I stumbled upon that a few years ago, and I was like, that's kind of strange. And then the more and more as the years went on, when we would get into the detox piece, we would see these age-related spots start to disappear. They would fade or almost like flake off. It was the most bizarre thing, and that's the only thing I can see is the toxic component. Cleaning out the toxins in the skin starts to change, starts to improve. And after the toxic piece, so we talked about a bunch of different problems with skin. What are if someone has a skin disorder, what does the conventional medical model do for that?
So most of the time, I mean, if it's obviously an active infection, they're going to swab it, right? So if it's shingles, it's you know, if they're like, oh, this looks like it's following a pattern of a nerve or something like that, then they're going to look at it and say it's a shingles virus, so they can give you an antiviral. If it is like an open source, say you have like impetigo or so staph or something like that, they're going to swab it and they can culture it to see what kind of bacteria is on there. And then they're going to give you an antibacterial or an antibiotic cream. If it's an inflammatory issue, they can give you, like prednisone, they can give you a steroid. If it's an autoimmune condition, same thing, they can give you an immunosuppressant or a steroid again.
Mm-hmm.
I guess actually now that I think about it, one of the things that we didn't really talk about is like, say they have sensitivity to chemicals, because I actually had developed this when I was like in high school, right? So I was a wrestler, and I actually got to the point where like I would develop like hives and I would break out when they would wash the mats with certain disinfectant chemicals. And so I'm going to let you go ahead and spitball off that, because I know that you're really, really good at this type of stuff too. Why don't you go through about if someone has lost their tolerance to chemicals, or if they've lost their tolerance to, like something that they put on their skin, like lotion or something like that.
Yeah. So loss of immune tolerance is where then your immune system gets mad and starts responding. Your skin is an open organ. Really, it seals our body up, but it's breathing, living, it's existing, it's communicating with the external environment all the time. And when we have a strong immune tolerance, when we have a healthy immune tolerance, we can handle a lot. We can handle chemicals, we can handle smells, we can handle perfumes, we can handle a lot of different foods. But as our immune system becomes exhausted and broken down over excessive exposure or to chemicals or other things, what'll happen is you lose your protective barrier. That's the easiest way to explain it. But you're actually losing your immune tolerance. You lose your protective barrier, and even things on your skin will cause a problem. That's kind of like why the mats were doing that for you. It was the chemical on the mat that you lost your immune tolerance via your skin, and it created a problem. Now, the last time I looked at any kind of topical agent you put on your skin, and maybe you can correct me if I'm wrong, Dr. Kolby, but the last I read was around 24 to 26 seconds. Anything you put on your skin, they will track in your bloodstream now. So we're seeing a lot of pharmaceutical companies we're expecting over the next 5 to 10 years, you're going to see a lot of pharmaceuticals being made in the form of topicals, just because it's a lot more efficient to build a chemical or a drug that doesn't have to withstand the damaging effects of the digestive tract. So to answer your question, I guess a loss of oral tolerance, a loss of immune tolerance, a loss of skin tolerance due to chemicals and lotions and creams, that's where your immune system becomes weak. And when your immune system becomes weak, it'll start responding to everything, and you'll end up with all these reactions. So I guess from an immune standpoint or a sensitivity standpoint, a loss of immune tolerance.
Sure. Well, and I think that you brought up a perfect point too with like the pharmaceuticals and stuff like that too, because even if you go in a lot of cases, allergy testing, they'll do what's called a Barch test. Mm-hmm. So they actually will scratch your skin, and they'll use like an antigen or like a potential allergen. And then if you have a histamine response to that, so that like that area gets inflamed or it swells or it becomes itchy, then you know that you're reacting to that. So that's another instance where you're using your skin as like that. They're checking the barrier, and then they're checking that immune reactivity to that. So
that's exactly right. So in the medical model, so just to reiterate, there's a lot of things that cause skin disorders. There's immune intolerances, autoimmunity, where your body's attacking itself. And you can assume it's an autoimmune or an immune problem if you go on a steroid or a topical steroid, an oral steroid, and you feel so much better. These steroids shut down your immune system. So that's a great indicator to know that your problem is immune, and a lot of them are. And then there's the bacterial infections, the viral infections. What else did we talk about?
Could be a fungal infection.
Fungal,
right?
yeah.
You get something like candida.
Mm-hmm. That's true. So many different aspects, but what we were touching on there was the medical model, the conventional medical model. So say I have all these skin disorders or acne. When I grew up, I had a lot of acne. I come from a small town in Canada. I probably had more acne than anybody in that town. In fact, at that time, I would put money on it. It was horrible. And the doctors there, they gave me, first started me on tetracycline. It was absolutely devastating, not the tetracycline, but having acne that bad as a teenager. It started early and it didn't end until extremely late. So tetracycline is an antibiotic, trying to knock out everything. And, it had its place after it could affect liver and everything with high doses. And then the next strategy for acne was Accutane. And I think it still exists. It's really damaging. It creates arthritis and all sorts of emotional conditions. But even acne it tends to be a bacterial or a toxic component. I see people that have digestive issues that go on long enough, like I did when I grew up, and I didn't know there was any connection between digestion and skin. I was just a kid in a small town. They didn't know any of that. And it just manifested in acne. So a lot of causes, but the medical model, I guess if we want to summarize, there's going to be two strategies. There's going to be the steroids to shut down the immune system so it doesn't react to yourself. And then the family of antibiotics, which is going to kill any bacteria, after the diagnostics that they do. But that tends to be the two strategies. Is there any others that you can think of that the conventional medical model uses?
If it's viral, they'll give you an antiviral. That's about it. Mm-hmm. I can't think of any off the top of my head. No.
So after all of that, what in your office? Someone comes in. Now I know the nature of the skin disorder is going to determine what kind of testing you're going to do, right?
Sure. Yeah, absolutely. I mean, that patient that came in last week with that infection, I sent her out, and they're going to do a culture to make sure to rule out. I'm pretty sure I know what it is, mm-hmm. But we're going to make sure, and then I'm going to refer to the appropriate provider because she's going to probably need antibiotics in that case. But yeah, as far as that, I always do testing if I think it's, and in most cases you can tell if you've seen enough. So most times they're like, oh, I got this rash right here. And you're like, oh, that's shingles, Yeah. You're going to need to get an antiviral, and you can use some things like lysine to help, kind of
inhibit a little,
combat it additionally. But as far as like other treatment options, after you've figured out, or treatment or management options, after you've figured out what it is, you can do stuff like helping them detox their liver, or you can do things to like supplement and maybe help regulate their immune system a little bit so that they're not stuck in an autoimmune case where they're destroying their own tissue. You can do things like diet modification, lifestyle changes and stuff like that. Even like basic hygiene can actually be pretty huge for helping some people with certain skin conditions.
And just to touch on that, you said basic hygiene, of course, staying clean and washing and all of that. But what if someone is using a soap that they lost immune tolerance to and they don't?
Yeah, I've actually had that. I've had people who all of a sudden they're using a specific shampoo and they're like, I've got dandruff all over the place. And it's like, well, did you change your laundry soaps or your detergents or anything like that? Well, no. But I actually had a lady that went through a really nasty divorce, and all of a sudden she broke out, and it was because she basically started to react to her shampoo and her lotions
because of her emotional stress from the divorce.
Because of the amount of stress that she was under because of the divorce. Yeah.
Mm-hmm. So she lost her immune tolerance.
You bet. And then she reacted to anything and everything. As soon as we ran the tests, I was like, oh crap.
Yeah. So those are some great strategies. So maybe to summarize, now going back to the fundamentals in natural medicine, how I know I do it, and I know you do it similar, ruling out any kind of immune irritation, right? Usually testing will tell you that right away. But working with a provider first, that'll identify what the problem is. Is it fungal? Is it bacterial? Is it immune? And or is it toxic, right? Is it just a toxicity piece? If it's a toxicity piece, I see that a lot of times someone's going to have digestive disturbances where they end up getting the contents that should be on the way out of the body through the digestive tract. It's leaking back into the bloodstream. I know we did a really good podcast on the brain-gut connection. We talk about leaky gut. So if anybody's watching or listening, go back to that podcast previously and you'll learn all about leaky gut and find a way to correct that. So leaky gut will create toxicity. Ruling that out. What would be the approach for somebody, or generalized approach for someone with autoimmunity that they think it's an immune irritation?
Sure. So actually, to piggyback off what you said, we've actually done a podcast on autoimmunity too. So if you're unfamiliar with autoimmunity, go back and listen to that one. We can dive a little bit deeper about what it is and what are some causes and some symptoms and stuff like that. But if I have a patient that does have an autoimmune like skin condition, so say they have vitiligo, for instance, then I'm going to look at what are those immune triggers, right? We're going to do some testing to figure out what are those triggers that are setting off the immune system. What is that immune system really, really sensitive to? And we're going to pull those out because you want to remove the irritation.
And sorry for interrupting. That could be like foods or chemicals or like
Yep.
carpets in your home,
Chemicals, stress,
dust.
right? Yes. It can be pretty much anything. Most of the time, the testing that we do is like foods. It's foods, bugs, toxins, stress, right?
Mm.
So we're doing testing to figure out what those are, and then we try to pull those out so that their immune system isn't reacting to those anymore. Then we try to heal their barriers. We are trying to basically change the frequency of what their immune system is exposed to stuff by changing the rate that their gut is leaking, and it's only letting specific things through instead of everything through.
So it's kind of generally speaking, it's like you're helping the immune system rebuild its shell.
Yeah, exactly. That's perfect. So those are like the first two things, and then you're going to give them things that can kind of help regulate the immune system. So you're supporting T regulatory cells, and then you're trying to not necessarily suppress but modulate Th1 and Th2 pathways. That's getting a little bit deep, but your immune system, you're just trying to modulate it and regulate it so that you stop attacking yourself, and then you are more specifically attacking things that are actual antigens, or such as potential infections like bacterial or fungus or virus or parasites or whatever.
Mm-hmm. Yeah. So that's kind of, we covered the toxic component, the immune component. And of course, if there's bacterial or viral infections, that's why you need to work with a qualified healthcare provider that's going to be able to rule those in or out. I know clinically, the majority of skin disorders that I see, and I see a lot of eczema, psoriasis, pigmentation disorders due to fungal infections, the majority of what I see is either an immune irritant, the majority, I'm generalizing, some immune irritant where a steroid works. If a steroid works, you know it's the immune system is the culprit. So an immune irritant or a toxic component. I don't know how many people I see that have really bad skin due to significant leaky gut. Once you correct that leaky gut and start cleaning up the liver, you will see skin change with most cases. So that's kind of what I see. Any cases that you worked with that you were able to see significant changes or from when they started versus after?
Yeah, I mean, I've had a couple that are big, and it's kind of, I don't see so many skin conditions that are the main common complaint.
Yeah.
Most of the people come in and it's something else. But I have had people, actually, I had a patient that her main complaint was her mother had Alzheimer's, and she was worried that she's predisposed to Alzheimer's. So she was looking for some preventative steps that she could take to kind of like improve her quality of life as she aged. And we put her on a really specific diet. We put her on some supplements. We did a lot of testing to see what those immune triggers were, and we pulled them all out. And she had, for like the last 30 years, I think, she's in her 70s, she'd been suffering from psoriatic arthritis. Or no, rheumatoid arthritis, excuse me. And so she had rheumatoid arthritis, and for like the last 30 years, she's not been able to get her wedding ring off. And she was so swollen, and she had all this other, all the other symptoms associated with rheumatoid arthritis. But after like 6-8 weeks, she was actually able to get her rings off of her fingers. Her complexion and her weight had all changed based on what she had done during the program. So it is possible. My wife had a patient with vitiligo. They did some dietary changes, and her hand, she was really self-conscious about it because she was like a teller at a bank, I think.
Oh, wow.
And her hand was like white, and everyone's like, oh, what happened type of deal. And they made some dietary changes after some testing with her, and actually she got all the pigment returned to her hand as normal. So even things like autoimmunity, if you remove those triggers and you do the appropriate testing, it is possible to get these big changes. So
it is, yeah. And there's a lady I worked with. She worked in actually a health and wellness clinic, and she had severe eczema. Now, I have never seen a case like this in my life of eczema, and she was on mountains of prednisone. Now her blood sugar was sky high because prednisone can turn people into diabetics and create osteoporosis because it's bone thinning. So she was on mountains of prednisone, and she would get a little bit of relief, but at night her sleep was highly affected because she couldn't even have the blankets on her skin. It was all over her body except her face, and it irritated. Just the weight of the blanket was painful. If she went for a shower, her skin would dry, and it would make it even worse. So she would lather up in lotions to keep the oxygen off her skin so it wasn't as painful. It was absolute misery, and I didn't know how far we would get, because we knew the steroids were some days it was keeping it down so she could get a little bit of sleep, but her body was still covered. After what we did, a big part of it was her gut. She had a lot of leaky gut. It went on for years. And again, there's that podcast, video cast you can watch and listen to. There was significant liver toxicity. Even her eyes were jaundiced, like yellowing, because the liver was backed up. And so I knew there was a lot that we could do. So once we cleaned up the gut and sealed that up, and we worked really hard on the liver and did the testing for those immune triggers that were aggravating, because eczema, it's an indicator of the immune system deteriorating the tissues. And this is a good case for pharmaceuticals, because everything we did, it knocked it down, 90%, which was remarkable considering she was dealing with it for 20 plus years. But she still needed some prednisone to keep it down that 100%. So I think it's a great case that a lot of times a little bit of medication can be very helpful in these cases. 100% lifestyle and hopefully minimal medication so you don't get the bad side effects of it. But as long as she keeps following what she's doing, she's not going to have the nasty effects of too much prednisone.
Right. Yeah. Like a little bit. I mean, none is ideal, but if you have to take a little to just completely manage it, then why wouldn't you, right?
Exactly. We're lucky we have that option. But in our current healthcare model, it's 100% pharmaceuticals and nothing else. And people don't get the outcomes that they would want. So I think, I don't know where else to go with this with regards other than, the toxic component, the immune component, making sure you have a proper exam and doing the proper testing. I think that's a big thing. Did you have anything else to add, Dr. Kolby?
No, I think that pretty much sums it up. Obviously, if you guys got value from this, or if you found that this information was worthwhile, and you have a friend or a family member or a loved one that would benefit from this information, please share it with them. Like I said in the intro, if it's your first time watching, hit like and subscribe. And if you have a health condition or a concern that you would like us to break down, you can email us at info@brainstormingwiththedocs.com, and we'll do our best to get back with you. There's a lot of information available on our websites. My website is www.northlakeschiropractic.com. Dr. Glenn's is drgharrison.com. Or you can Google the Center of Functional Medicine Denver, right?
Yeah, that's right. Yeah.
And he'll pop right up. And yeah, stay tuned, because we are going to continue to do this. This is really fun. And we're just trying to bring value to you guys. So like I said, if you have questions, comments, concerns, or you'd like us to break down anything, please get in contact with us. But until next time, my man, we'll have to come up with something else to go over.
All right. Yeah, we have a big list. So we'll talk to you soon.
All right, man. Sounds good.
Bye-bye.